Okay, thank you. Well, good morning, everyone, and thank you for joining us. Bonjour à tous et merci d'être présent. On behalf of the University Health Network, it's a privilege to welcome you to UHN's Princess Margaret Cancer Center, a global leader in cancer research, care, and education. Today marks another important milestone for our clinicians, scientists, and all of Team UHN, and for our partners in government. I'm honored to welcome our distinguished guest, the Honorable Sylvia Jones, Ontario's Deputy Premier, Minister of Health, and Member of Provincial Parliament for Dufferin-Caledon. Cancer remains the leading cause of death in Canada. Nearly half of all Canadians, 42%, will receive a cancer diagnosis in our lifetime. This figure underscores not only the scale of the challenge before us, but the urgency of sustained system-level action. As our population grows and ages, the number of people diagnosed with cancer continues to rise. At the same time, this trend also reflects significant progress. Early detection through organized screening, more precise and effective therapies, and a growing population of Canadians who are living longer and better after cancer, thanks to the investments of our government. The evidence is clear. When cancer is detected early, outcomes improve substantially. Survival rates increase, treatments can be less invasive, quality of life is preserved. This understanding is reshaping the future of cancer in Ontario, and our science is reshaping how we understand it around our world. It's why earlier this year, UHN launched the Peter Gilgan Centre for Early Cancer Detection and Prevention, a very ambitious multidisciplinary initiative focused on identifying cancer earlier or preventing it altogether at a point where our interventions have the greatest clinical and societal impact. Yet behind every statistic is a person, a family, a future. At UHN, we're guided by that human reality. It informs our research priorities, our clinical innovation, and our unwavering commitment to reducing the burden of cancer so that people can live longer, healthier, and fuller lives. We're proud to advance the work in close partnership with the Government of Ontario, and especially with our Deputy Premier, whose leadership and collaboration are essential to transforming cancer outcomes at scale. With that, it is my pleasure to invite the Deputy Premier and Minister to now make an important announcement. Welcome back.
Thank you, Dr. Smith, and good morning, everyone. It is indeed wonderful to be back at Princess Margaret Cancer Centre alongside Dr. Kevin Smith and Dr. Enrique Sanz Garcia. Thank you to the UHN team for hosting us today at Canada's leading oncology hospital and one of the top 10 globally. Under the leadership of Premier Ford, our government continues to make record investments to take decisive action, to protect and strengthen healthcare systems across Ontario, and to connect more people to the services they need when and where they need it. In 2024, our government lowered the age of self-referral for mammograms from 50 to 40. And since then, more than 280,000 women have been screened through self-referrals. Recently, I was here, as Dr. Smith mentioned, at Princess Margaret to announce our government's fast-tracking of new breakthrough cancer drugs, including one that treats colorectal cancer. Colorectal cancer is one of the most commonly diagnosed cancers in Canada, fourth in Ontario, with rates rising among younger people. It is also the second most common cause of cancer death among Ontario men and the third for Ontario women. But when colorectal cancer is found early, 90% of those diagnosed will recover, making early detection absolutely critical. That is why our government is lowering the eligibility age to allow people to access publicly funded colorectal cancer screening to help more people receive life-saving treatment services sooner. Starting July 1st of this year, the eligible age group will be lowered from 50 to 45 for all individuals and for those 40 and under at increased risk. This historic expansion will give more than 1 million additional people the option to connect to life-saving screening services to detect and ultimately treat colorectal cancer sooner. Beginning July 1st, eligible people across Ontario, ages 45 to 49, will start to receive letters from the Colon Cancer Check Program to help them connect to an initial colorectal cancer screening test. People at increased risk, meaning they have one first-degree relative, a parent, a sibling, or a child with colorectal cancer diagnosed before the age of 60, or more than one relative diagnosed with colorectal cancer at any age, will be eligible for publicly funded screening at age 40 to 40 or 10 years earlier than the youngest age a relative was diagnosed. Research shows that lowering the screening age is critical to detecting colorectal cancer earlier when it is most treatable. By connecting more Ontarians to colorectal cancer screening, we are continuing to build on our progress and ensuring people have timely access and diagnosis to treatment as early as possible. Thank you to everyone here at Princess Margaret who provide innovative and world-class cancer care to Ontarians each and every day. It's now my honor to turn it over to Dr. Sanz Garcia to share a few words. Stay well. Thank you.
Thank you, Minister Sylvia Jones, for this important announcement and for your leadership in advancing evidence-based cancer prevention and care in Ontario. Today marks a meaningful step forward that responds directly to the science, reflects emerging realities in cancer trends, and we hope builds momentum for similar progress across Canada. Colorectal cancer remains the fourth most commonly diagnosed cancer in this country and the second leading cause of cancer-related death. For many years, it was considered a disease that primarily affected older adults. That is no longer the case. We are witnessing an alarming rise in colorectal cancer among younger people. Research shows that individuals born after 1980 are 2 to 2.5 times more likely to be diagnosed before the age of 50 compared to previous generations. Too often, these younger patients are diagnosed at a more advanced stage, when treatment is more intensive, outcomes are poorer, and the impact on families and working life is profound. Lowering the age of screening to 45 is a critical, important response to this shift. It allows us to detect precancerous lesions earlier and to identify cancers at a stage when they are far more treatable. As an oncologist, I often meet patients at one of the most difficult moments of their lives. Early detection means fewer of those moments, fewer advanced cancers, fewer life-altering surgeries, and far greater chances of cure. The evidence is clear. Prevention and early detection save lives, and early diagnosis is consistently associated with significant better outcomes. Importantly, the evidence also shows that while expanding screening may increase costs in the short term, it leads to meaningful long-term savings for the healthcare system. Detecting and treating early-stage disease is far less costly and far more effective than managing advanced cancers. At UHN Princess Margaret Cancer Center, we are proud to lead the development of innovative treatments for colorectal cancer, including target therapies, immunotherapy, and less invasive, more effective approaches to care. In parallel, we are advancing critical research to better understand the rising incidence of this disease, examining factors such as diet, sedentarism, lifestyles, environmental exposures, and the role of microbiome. But science and policy must also be matched by awareness. We encourage individuals to be attentive to the signs and symptoms of colorectal cancer and to speak with their healthcare providers if something doesn't feel right. Early action by patients, clinicians, and the health system can change outcomes dramatically. Today's announcement reflects forward-thinking leadership grounded in evidence. It's a vital step that will help more people live longer, healthier lives, and it brings us closer to a future where colorectal cancer is detected earlier, treated more effectively, and prevented whenever it's possible. Thank you so much.
I think that concludes the formal portion. I'll turn it over to the minister's staff if they wish to have any discussion with the media.
We will now begin to take questions from the media. Can all media present please line up behind me? As a friendly reminder, the format is one question and one follow-up. Please state your name and your outlet before your question. Thank you.
Hi, Minister. Tina Yazdani with the Trillium. Minister, there's been reporting that you made comments in a closed-door speech criticizing the OHA for not being more appreciative of the government's hospital funding announcement. Are you suggesting hospitals and the OHA should publicly praise your government's funding decisions in order to maintain a good relationship at Queen's Park?
No, what I was saying in that closed-door meeting was that the Ontario hospitals have a very willing partner in the province of Ontario. For the fourth year in a row, we've increased annual base funding to hospital operating dollars by $1.1 billion, which equals almost 4% across the board. When you compare that to the entire healthcare system, it clearly shows that we are absolutely going to be a partner with our hospitals. What it also shows is we have an obligation as government, and leaders have an obligation to make sure that as those funds flow, they are flowing to frontline patient care.
But
Thanks.
I guess my follow-up would be, are you suggesting that they should be publicly praising the government for making these investments?
No, I was simply highlighting what we already have done, and we need a partner in our hospital systems in the same way we need a partner in our primary care providing systems, in our mental health providers. When we work together, we come forward with proactive solutions. You know, I think of today's announcement. This is based on clinical advice that has changed over the years, and the fact that we were able to not only have that clinical advice, but also be able to react to it, suggests that when we are working as partners, we end up having very positive care and outcomes for the people of Ontario.
Hi, Minister. Alison Jones with Canadian Press. I wanted to ask today about the hantavirus. We know that there are 2 Canadians who were on the affected cruise ship. Are you able to say if they're Ontarians, and if so, what sort of isolation, contact tracing measures are in place?
Yes, the 2 individuals are in fact Ontario residents, and they are actively being monitored and working with the local public health authorities on a daily basis to make sure that the isolation is occurring, but that has been going on since they returned home.
And are you able, I've got a few more about this, it's pretty important. Given the lengthy, what I understand is a pretty lengthy incubation period for this virus, are you able to say how long public health officials have told them to isolate for?
So we are getting regular updates on not only these 2 individuals, but preparing to see if there are any other individuals who could perhaps return to Canada and Ontario. The incubation and monitoring period will likely be in the 30-day period, but I want to reassure you that that is ongoing and has already started as soon as they returned to Ontario, and happens on a daily basis.
And is there contact tracing being done for them, or no, because I guess they're asymptomatic at the moment?
So again, Public Health Unit is very much in charge of the monitoring piece of it. More information as we can release the information that they have. At this point, it is believed that they are not in any way a risk of transmission, but it is fluid, and we'll continue to have those monitoring situations.
Thank you. That concludes our media availability today.
Well, I think the important piece is that the federal government has to understand as people return to Canada, to Ontario, we need to make sure that there is a pan-Canadian consistent approach. So we're working actively with our federal partners to ensure that. But again, I will say for these 2 individuals, they have been from day one monitored and assessed on a daily basis. Thank you.